Hi, my name is Dr. Brad Baylor. I'm a family physician in Sylvan Lake, Alberta. I'm also serving as a medical advisor on the Primary Healthcare Opioid Response Initiative. In this short video, I would like to share my thoughts on the value of using measurement of offers of care to improve opioid care for Albertans. We've been working in Alberta for some time on Patients Medical Home, and the work around the opioid initiative is no different. We know that the major value of the Patients Medical Home is in looking at a different way to care for people with complexity. In this model, we have continuous relationships with our patients, both as providers and as a team. And that continuous relationship can create the right conditions for us to have challenging conversations about even the most difficult problems that patients may face. What we do in primary care is look after those with complex needs. If you look at any primary care practice, a big proportion of what they do is manage patients with complexity. The opioid population is really no different, and given the complex nature of opioid use disorder, there's an understanding that successfully treating patients on opioid agonist therapy requires different approaches and different offers of care to patients. In my own experience, my team approaches this population no differently than they may approach any other complex population. It requires a team-based approach, it requires a lens of improvement, and it requires us to think comprehensively about how we help patients navigate psychosocial complexity. So what actually goes into an offer of care for opioid use disorder? We have to start with engaging with our patients and understanding their personal situation and where they might be along their care journey. This often requires a comprehensive assessment, part of which might be done by the physician and part of which might be done by our team. We need to consider things like harm reduction, and we need to take a patient-centered approach to comprehensive care planning. And often we have to acknowledge that patients may not be at a state of readiness to talk about opioid agonist therapy. All of this might occur before we would ever offer a patient opioid agonist therapy. And even if we do offer that care, there's often a big gap between that offer and patients starting on opioid agonist therapy. What we're really trying to do in this initiative is measure all the care that goes into that gap in terms of engaging patients, understanding their personal situation, care planning with them, offering them opioid agonist therapy, and moving them through the starting therapy itself. Like any quality improvement effort, breaking down the process of how we offer care and measuring along the way helps us identify gaps in our process and opportunities for improvement. We're not new in Alberta to measuring offers of care. Some of you might be familiar with the ASAP initiative, which stands for Alberta Screening and Prevention. One of the improvement methodologies we used when we rolled out ASAP was to measure offers of screening care. And by measuring these offers, we were able to show that quality improvement is a stepping stone to sustained care improvement. So we have experience in doing this with other initiatives, and it's been proven successful in moving us along the way. We're using this knowledge that we gained working with practices in Alberta in the Opioid Response Initiative. This may sound daunting, but we have resources and tools in place to help you along the way. Through the Primary Healthcare Opioid Response Initiative, there is actually an opioid change package that provides you with high-impact changes, potentially better practices, measures, and tools that you can use with patients who may have opioid use disorder. It provides us an overarching framework to help guide our practices and gives us suggestions on what kind of changes we may make. It's about far more than opioid agonist therapy. It's about all the steps along the way. You'll even see tools customized to the various EMRs in Alberta, as well as measurement tools that can be used with the EMR. These tools in the change package can be found on the top Alberta Doctor site listed at the top of this slide. So this is a call to action from me to you, an opportunity to strengthen your patient's medical home. If you sign up for this initiative, you'll receive a whole host of supports that will allow you to do things like track and measure data, build capacity within your EMR. You'll have direct support from an expert EMA consultant in making these practice changes. And in the end, you'll be able to demonstrate the breadth and quality of work that primary care is doing to address the opioid crisis. If your practice has these characteristics, and if you're willing to take on a challenge and help us demonstrate what primary care is doing in response to the opioid crisis, we'd love to work with you and how we measure offers of care for this patient population. Please contact us at the website below.